affect positive change in the Mohawk Valley through his efforts in Washington. We appreciate the opportunity he's provided us and our community, and for bringing this discussion here to us today. Congressman Arcuri.
Worked hard to make sure that this bill didn't come to a vote before August, and I made it extremely clear to the leadership in Congress that if this thing came to a vote before I had a chance to come home in August, that they could not count on my support. Didn't matter what the bill said. For me, it was more a procedural thing to have an opportunity to do exactly what we are doing here today. And I want to say that I have not taken a position on the bill because, frankly, there are a number of things in the bill that I like and a number of things in the bill that I don't like. I didn't write the bill, and I'm not here to defend the bill. I'm here to talk about health care. So primarily, what I would like to hear more than anything else is your views on what you think is good, what you think is bad, what you think should be improved, should not be touched. And I'm looking forward to a really good discussion in terms of what we think needs to be done and what we think we can do to make it better. So I appreciate, again, all of you for being here.
And if I can just turn around and ask, how many people are on Medicare here? I would like to know why the rest of us can't have the option to buy into Medicare. I'm not saying
to it is that I'm not sure we can afford to do that. Well, I mean, that doesn't, you say we will pay, but not everybody can afford to pay it. I mean, that is what we're trying to do. I mean, that's the problem that some of the people have with the public option, and that is that it's a sliding scale that they're talking about, because not everybody can afford the premium that's going to be required. So the concern is with the pay, and that's one of the concerns, with the cost of it.
Do we have a mic in place?
I can't walk for any period of time, and if I lost my insurance, the drugs that I have to take in order to walk would cost me over $1,000 a month. It's been estimated that if I went up and bought my own insurance, it would cost, the kind of insurance that I get now, it would cost over $2,000 a month. If I lost my insurance, I would be in very dire straits. I wouldn't be able to walk. I lived my whole life in pain. And I think that one thing that people are not really paying attention to is 37 million Americans who don't have insurance now. And the 14,000 Americans who lose their insurance every day. And it was very gratifying to hear you speak that you may be supporting public option. But my question to you is what about the vulnerable people who wouldn't qualify for Medicaid or Medicare, like me? Because if I get dropped, I'm done. My wife can't afford that. What about us? Why aren't people even, they think about their own selves, but they're not thinking about the people who are most vulnerable. Most of the people in this room have insurance. The ones that don't have insurance usually don't come to these meetings. But there's 37 million of them, and I'm sure there's more than a few in this district. And just my question to you is, what about the vulnerable people?
Well, that is the reason that we are here. That is the reason that we are taking this up for the people who do work hard, who do not want a handout, who do want to be able to pay for their health care, but they cannot afford health care insurance. That's what we're trying to achieve with the bill. That's exactly that's exactly the point. That's exactly the number. Now, I've heard different figures in terms of the number of uninsured. You say 37 million, I've heard 47 million based on census. Now, but I can tell you that there are 71,000 people in the 24th Congressional District that don't have insurance. Now, some of those are going to be individuals who choose not to have insurance. Somebody that may be 20, 22, 23, who figures that, that they'd rather take a chance rather than pay for it. There are going to be some that are counted in there that are illegal, and they're not going to be eligible for it. But then, what about they will not be. But what about the rest of it? What about the working poor? The people who, if they lose their insurance, they're not going to get it. that is the purpose that we are considering this bill. That's what we're trying to do. We try to do it in a way that, it's not sustainable. We know that the healthcare system at this pace and this rate is not sustainable. So how do we move forward to ensure that we create a healthcare system that is sustainable, number one, that is affordable for small business, but that provides healthcare insurance for individuals who work, who try hard, but can't afford a high premium. So that's what we're trying to do. I mean, I don't have a specific answer, but I can tell you that's the purpose of why we're having this town hall meeting and trying to find the best way to propose a bill.
You constantly talk about how you're going to continue to fund this bill and make it sustainable. One of the things that I've read, and I've tried to educate myself as best as possible, is some people have said the bill is very lengthy. For 5 years, I worked at a job where I didn't have health insurance, and I accepted a job, which is a great job, but at lower pay because it had a great health insurance plan. And now I hear that one of the ways that you might fund future payments with this bill is through taxing people who have insurance.
I would not support that. I won't support that component. That's not in the present bill. People have done, and you're the exact sort of example of the reason that I say that there are individuals who have done other things, either negotiated a different sort of contract with their employer to get less pay so that they can be entitled to it, and that's the exact reason. But having said that, we still have to figure out a way to make sure that everybody has some skin in the game, so that everyone has to, the present bill, and again, I'm not defending it, does have a sliding scale within which individuals have to pay for it. We have to make sure that, again, that it's affordable, but that's why I'm not supporting that position. Insurance coverage for illegal aliens. It will not. I won't support it. It just doesn't. It doesn't.
It does not.
Let me read you page 143, section 246. No federal payment for undocumented aliens. Nothing in the subtitle shall allow federal payments for affordable credits on behalf of individuals who are not lawfully present in the United States. I can tell you that now we said we weren't going to do that. Now let's try to give everybody an opportunity to be heard. And I can tell you that I suspect very strongly that there will be a number of amendments that say that nothing in any bill that's passed can give health care to any people who are not in this country, and I will support that. So I can tell you that I just don't think that it just doesn't, it's not in the bill. So I think that's one of the misinformation things that we have.
I'd like to get out.
For me to sit here and say we have a public option and not be prepared to take it myself, I will take the public option if that becomes available.
Roll up.
Right here, this gentleman.
I dare say that what you fought for when you served in the military was the ability to stand up and do exactly what you just did. Voice your opinion and criticize your government if need be. That's what makes us Americans and makes us the greatest country in the world.